health condition where the pancreas cannot produce enough insulin for the body's use, or the body cannot sufficiently use the insulin it produces. Per our findings, the number of people diagnosed with diabetes globally has more than doubled in 2 decades. For instance, in 2019, over 1.5 million deaths were caused directly by diabetes. And also, 48% of deaths caused by diabetes happen before the age of 70. So today, we are going to be talking to health experts to see the severity of diabetes in the Ghanaian setting and also to educate us more about diabetes.
Diabetes is basically raised blood sugar levels, which usually puts our organs at a risk of damage. Some of the risk factors include physical inactivity, weight gain, and a family history of the disease. It can present with symptoms such as increased thirst, increased urination, increased appetite, and blurry vision.
So we have 2 types of diabetes. We have the type 1 diabetes and the type 2 diabetes. The type 1 diabetes is usually as a result of insulin deficiency, usually resulting from autoimmune destruction of the pancreatic beta cells. While else type 2 diabetes is a combination of insulin resistance and decreased reduction of insulin as well.
Diabetes is a condition in which there's chronic, in medical terms, it means that there's chronic hyperglycemia. This may be due to absence of insulin or a problem with its action, which means that for such patients, they have elevated. We say that the sugar in their blood is most of the time elevated.
According to the specialist, diabetes go beyond the mere rise in blood sugars, as it can affect major blood vessels, which could lead to stroke, blindness, miscarriage in pregnant women, and stillbirth. It also accounts to more than 50% of kidney cases. The danger in this is that since your nerves are damaged and can't fight infections effectively, it weakens you and gradually leads to death. As of 2019, diabetes and kidney disease due to diabetes caused an estimated 2 million deaths.
So we usually check the blood levels of the sugar in the blood levels. So we call it random blood sugar. So we usually screen patients with diabetes. We usually screen their random blood sugars. Yes. So if it's at high levels, they usually present with the symptoms my colleague mentioned, as increased thirst, usually blurry vision, increased appetite.
A foot ulcer is the initial event in more than 85% of major amputations that are performed on people with diabetes. Throughout the world, it's estimated that every 30 seconds, one leg is amputated due to diabetes, and 10% of people with diabetes have foot ulcer. Between 10 to 15% of diabetic foot ulcers do not heal, and out of these, 25% will require amputation. In one study, research showed that following an amputation, up to 50% of people with diabetes would die within 2 years. Following our findings, we spoke to a few diabetic patients of the Holy Family Hospital to see how they are dealing with the situation. Madam Esther Kwa, who has been suffering from the disease for 30 years, says it has really changed her life since she can't go anywhere and have to solely depend on her children for survival. This sickness is very bad, and I wouldn't even wish it for my enemy, she said.
She said, "Ya dear, oh yeah, the pa."
This is Madame Mariama Issa, who has also been suffering from the disease for close to a year.
Name Johnson 10 by heart. Me kodana just want to mean that.
When it started, I used to urinate a lot, she said. I can barely sleep at night and my urine was very sugary. When I came to the hospital, it was confirmed that I was suffering from diabetes and hypertension. I lost my job due to this disease. At the beginning, I lost so much weight, but since I came to the hospital and followed the directives of the doctors, I'm gradually recovering. We are advised to eat more vegetables and fruits that are less sugary. Also, we should eat less oils and fatty food. I advise youngsters to take good care of themselves, eat well, and also stop overthinking.
Afutu ame wo mo say obi anhwe ne ho yie awo na duan di mu ene adwendwen so tibi ma diabetes ne pressure ne nyina wunya nti afutu ame de be ma menu no mo wa akire say obi anhwe ne ho yie na adwendwen pi ne so enye.
Mr. Yahaya Zakari, who has been suffering from diabetes for the past 5 years and a foot ulcer for 2 years, also has this to say.
My pomidina aswata, but my jumadiana mitime call right. Nti ewomwa boso mebia na makwa check up.
In the beginning, I was able to work for some time until my foot ulcer started. Now I can barely do anything by myself. The disease has gradually damaged my health. I couldn't perform well in the bedroom.
I feel so. Remember, you must have by foam. And I'm a diabetes.
High blood glucose levels that remain unchecked can result in something of negative domino effect on your health. This could mean damage to crucial organs and systems such as your blood vessels, kidneys, and eyes, among others. Dr. Na Oboshi, a physician of the Holy Family Hospital, has more to this.
Gestational diabetes is more or less linked with type 2 diabetes. And we know that type 2 diabetes is something that has some genetic components. In terms of the exact percentage, I cannot give it to you, but that likelihood is there and actually is quite significant. But if the child has this knowledge and is able to implement the lifestyle changes we've talked about, early on, it can delay the onset of the diabetes or prevent it altogether.
Diabetes-related amputation incidence is an indicator of the burden of the disease and the capacity of healthcare system to identify and treat high-risk individuals. Dr. Akwa, a practicing surgeon at the Holy Family Hospital, has the details to this.
So averagely in our facility as Holy Family, we tend to do an amputation quite frequently. We have 2 theater days in the week, and every day I can say we do averagely 1 to 2 cases per day. Normally, from literature, we have grace of the diabetic foot, from an ulcer to a dead limb. So most of the time, the patient that will come, they come with either the stage 4 or 5. Those are the late stages. When you talk about the 4, that means the front of the foot, from the toe to midfoot, is gangrenous or dead. And we talk about the last stage, that's the stage 5. That means the whole foot is dead. So mostly those are the stages that they come with, and whatever is dead, you have to remove.
Directly from the health experts the severity and how deadly this disease can be. Therefore, going forward, let us take very good care of our health so that growing up, we wouldn't have to use all of our life savings in taking care of such diseases.